I'm Dr. Poh, B.K. Poh. I'm a private urologist working in Mount Elizabeth Novena Hospital. To understand prostate cancer, you must really take a deep dive into what is prostate and what is cancer. So the prostate gland is a gland that only men have. Okay, so if you can think of the man's urinary tract as being the lower tract piece, is made up of three organs. You have the bladder, which is really the container or the storage tank of the urine. And then you have the prostate underneath the bladder. And finally, you have the outlet, which is the penis. Now, the function of the prostate is purely for reproduction. And no, it does not secrete any hormones. So when a man ejaculates, the liquid that comes out has two components. Now, the first component is, of course, the sperm. And the sperm comes from the testes, right? But the sperm doesn't walk. The sperm swims. So to swim, it must have liquid to swim in. Okay, and this liquid comes from the prostate. And it's a constituent that is made up of prostatic secretions as well as seminal vesicle secretion. Now, let's talk about cancer. What is cancer? Cancer is our body cell that has turned renegade. In a normal situation, a normal cell will be given an instruction to die the very moment it is born. Okay, so when a cell is born, it would have been given an instruction, a code, a signal when to die. Okay, so cancer is an immortal cell. In cancers, the cell line has forgotten how to die because this death signal has been switched off by carcinogens, right? It can be from smoking, from radiation, or what have you. Unfortunately, early prostate cancer has zero symptoms. There's absolutely no symptoms. And many times, by the time the patient has symptoms, it will be too late. So when the prostate cancer metastasizes, spread, one of its favorite sites is to the bone. And when the prostate cancer spreads to the bone, the pain is excruciating. So that's one. And many a times when the prostate cancer is locally advanced, it can block the urinary channel, and patients can present with urinary symptoms like poor flow, urgency, urine frequency, or even blood in the urine. But by and large, if these symptoms were to be due or caused by prostate cancer, that prostate cancer is generally locally advanced. The discovery of the Da Vinci robot has revolutionized how we surgically remove the cancerous prostate. When I started training, we were still doing open prostate surgery. Then we progressed to keyhole or laparoscopic surgery. Then we advanced to the Da Vinci robotic approach. So after 20 years of this what I would call revolution, we have seen how the advent of robotic surgery has revolutionized the way we do prostatectomy. The prostate surgery is not a dangerous surgery, right? It's not like you have to traverse or come across big, dangerous blood vessels, right? So mortality in prostate cancer surgery is almost a non-event, okay? But it is, or it can be sort of like quality of life-wise, very debilitating surgery. Now, in the past where we do open prostatectomy, we do not have the visibility, the magnification, and the 3D enhancement of the local anatomy to very intricately protect the nerves of erection and then take out the prostate. And many times we sacrifice the nerve together with the cancerous prostate. And the incidence of erectile dysfunction is extremely high in open prostatectomy. And then things got a little bit better with the advent of laparoscopic prostatectomy, right? The optics are better, we can go deep into the male pelvis, which is many times very narrow. And then we have the robot. Now, the robot dissection of tissue is very intricate. It has got very good optics. The camera of the robot is very clear in terms of optics. And the 3D appreciation of the anatomy makes nerve-sparing prostatectomy a reality. Okay, so with nerve-sparing prostatectomy, where we can protect the nerves of erection and then take out the prostate, is a game changer when it comes to preservation of erectile function. Now, the second thing that disturbs or potentially can disturb a post-surgery prostate cancer patient is incontinence. Stress, urinary incontinence. And it's not unheard of in the past, where patients go for open prostate surgery. They have to wear diapers for the rest of their lives. They stand, they leak urine, they laugh, they cough, they leak urine. But this phenomenon is uncommon now. So nowadays, post-RALP, robot-assisted prostatectomy, patients have much better continence control. I'm not sure if it is the best, all right, but certainly for every surgical candidate, it is teamwork, right? And every cogwheel, every nut, every bolt of this big machinery needs to work well. Okay, so it's not just the surgeon, it's not just the anesthetist, it's not just the machine, not just the robot, it is teamwork. So from the moment the patient is being diagnosed with prostate cancer, he would have undergone pelvic floor exercise by a specially trained physiotherapist before the prostatectomy. Because I would say the best way to prevent post-operative incontinence or post-operative complication is before the surgery. We start rehabilitation before we put the knife on the patient. So even before the surgery, once the patient is being diagnosed, the treatment starts. The treatment starts before the surgery. So we have a team of nurses, we have a team of pelvic floor physiotherapists to bring the patient through the pre-operative as well as the post-operative recovery. So that's number one. Number two is, of course, the hardware, right? The Da Vinci robot we have the latest version, but hardware can be replicated. It is easy to buy the hardware, but it is difficult to train the software. Okay, so surgical expertise is one, hardware is one, the team of nurses plays a very major role in the smooth outcome or the smooth progression of the treatment process. And after surgery, there is a protocol as to how we would like to manage the patient from day 1 to day 2 to day 3. And the whole process is very well thought out. So if I can make a guess why our patients have very good surgical outcome, I would think it is because of a very concerted team approach. Will your risk of prostate cancer be high if you have not enough sex or if you have too much sex? So which scenario gives you a higher risk of prostate cancer? It doesn't have to be sex, ejaculation, right? There are two camps, right? So one camp of one school of thought says that if you do not ejaculate enough, you are at a higher risk of having prostate cancer. The other school of thought or camp says that if you ejaculate too much, your propensity of having prostate cancer rises. I don't think there is any scientific data to prove or disprove, if there's such a word, either theory. So the jury is still out on that. Okay, so there is no correlation between the frequency of ejaculation to the risk of prostate cancer.